Depression is a disease that affects many people throughout the world, but there is always a way those people can be helped. They have symptoms such as sadness, hopelessness, lowered self-esteem, and a decrease of enjoyment in activities. Depression is a common but serious illness. However, depression can be treated with medication and psychotherapies. According to the American Psychiatric Association, depression has become the most common form of mental disorder. Every year, doctors treat 4 to 8 million Americans for depression, and about 250,000 of them are hospitalized. It affects people of all ages, nationalities, religions, and races. Every year, about 6.7% of U.S. adults experience major depressive disorder. Women are 70% more likely to experience depression in their lifetime than men. Non-Hispanic blacks are 30% less likely than non-Hispanic whites to experience depression during the lifetime. The average age to be diagnosed is 32 years old, but 3.3% of 13 to 18-year-olds have experienced a serious depressive disorder. Depression has been around for longer than people may think. In biblical times, Saul, who was the king of Israel, suffered from severe mood swings. In the 5th century BC, a Greek doctor, Hippocrates, treated patients who were said to have melancholia, which is a humor or a mood disorder. The people who had the disease were often sleepless, irritable, and restless. Many years later, in the 1600s, Hamlet, the moody character in William Shakespeare's play Hamlet, had signs of depression. In the 19th century, U.S. President Abraham Lincoln was so troubled by depression, he wrote a letter to his girlfriend describing himself as the most miserable man living. There are many different kinds of depression. The first example is major depression. This is when the symptoms get so severe that you can no longer function normally. It becomes difficult to work, sleep, study, eat, and enjoy life. A person can experience this only once in their lifetime, but it is more common that it happens several times to a person. The second example is persistent depressive disorder. The National Institute of Mental Health describes this as a depressed mood that lasts for at least 2 years. Psychotic depression occurs when a person has severe depression plus some form of psychosis. Psychosis is having false beliefs or a break with reality, such as delusions or hallucinations. Postpartum depression is what a lot of people call baby blues, but in reality, it is much more than that. This is what happens after a woman gives birth and hormonal and physical changes, and the new responsibility of caring for another human being becomes overwhelming. It is said that 10 to 15% of women experience postpartum depression after giving birth. Seasonal affective disorder, SAD, is when a person gets depressed during the winter months when it is colder out and there is less sunlight. SAD usually gets better during the spring and summer months. SAD may be treated with light therapy, but almost half of the people with SAD do not get better with light therapy alone. A common type of depressive disorder people are familiar with is bipolar disorder. Another name of this is manic depressive illness, and it happens by mood changes from extreme highs to extreme lows. Doctors aren't 100% sure on what causes depression, but the main reason people get depressed are because of genetic cause, changes in one's life, alcohol or drugs, reaction to a loss, not meeting the expectations of others, disappointment, and hormonal or chemical changes. Some people who are depressed have altered brain structure and chemical function. Doctors use technology that takes pictures of the brain, such as magnetic resonance imaging, also called an MRI, that show the brains of different people who have depression and how the brains look different. In this picture from WebMD is a PET scan that shows the brain of a person with depression and a person without depression. As you can see, the difference is the person that has depression has less activity in the brain. And you can pass this around to look at it. Trauma, loss of a loved one, a difficult relationship, or any type of stress is another main contributor to depression. When someone becomes stressed, their strength and energy may decrease. If there is an occurrence of depression in the family, it is possible that depression is part of genetics. Scientists are still studying to see if a family gene will make someone become depressed. If a person has a lot of change in their life, they could also experience depression. Feelings of depression may become present if someone gets a divorce, changes a school, loses or change in a job, financial problems, change in family structure, or a physical change due to an illness or an injury. Alcoholism is a major contributor to depression. There are more than 5 million alcoholics in the United States. 1/3 to 1/2 of the people that have attempted suicide have consumed alcohol before doing it. Alcohol and drugs are often used to lessen the symptoms of depression, but alcohol often worsens depression. Depression can also be caused by not meeting the expectations of someone. This is the main cause of depression in children. There are a variety of symptoms depressed people get, but not everyone gets the same symptoms. There are 2 notable symptoms of depression that are always there. A dysphoric mood. This is when a person is sad, blue, hopeless, irritable, or worried, and a loss of interest in pleasure in almost all usual activities. Someone who is depressed may also show signs of change of appetite, weight change, alteration in sleep patterns, loss of energy, psychomotor changes. This includes agitation or increased slowness of response, feelings of self-reproach, guilt, difficulty thinking or concentrating, and the biggest one is frequent thoughts of death or suicide. Even the most severe cases of depression can be treated if diagnosed. The first step is to visit a doctor or a mental health specialist who will give you a physical exam, and the next step would be a psychological exam. The doctor will refer you to a mental health professional. If you have any other illnesses, such as an anxiety disorder, it may eventually lead to depression. Depression may occur with serious physical illnesses, such as heart disease, stroke, cancer, AIDS, diabetes, or Parkinson's disease. The good news is there is always a way that depression can be treated. Once a person is diagnosed, depression can be treated in several ways. The 2 most common are antidepressants and therapy. There are 3 basic types of therapy. The first one is psychological therapy. This includes individual and group therapy, in which a patient discusses his or her problems with a health professional. The therapist will start by trying to make the patient feel at ease and comfortable. The second one is electroconvulsive therapy, also known as shock therapy. This is usually performed only by a physician who is a psychiatrist. What happens is a patient is given a sedative to relax and to fall asleep, and a weak pulse of electricity is passed through the head to induce the brain to have a mini seizure. Normally, the patient schedules to have 6 to 12 treatments in a 4-week period, but as few as 2 treatments may be enough. Because it works so quickly, it is often used when the depressed person seems to be suicidal. The third type of therapy is drug treatment therapy. Drugs that are used to cure depression are called antidepressants. The antidepressants work on the neurotransmitters, which are chemicals released at the end of the nerves in the brain. There are some side effects to taking antidepressants, such as headache, dizziness, and nausea. However, they may fade over time. Depression is a disease that affects many people throughout the world, but there is always a way those people can be helped. Depression is very serious. It is not just a sadness or something that is all in someone's head. It can affect you mentally by making you feel worthless, hopeless, and helpless. It can also affect you physically by changes in weight, sleep, and your immune system. If you feel like you are depressed or have symptoms of depression, talk to a close family member or friend. And if you know someone who you think is suffering from depression, talk to them and urge them to get help. State mental health agencies, hospitals, and therapists are all here to help the depressed person. Just remember that there is always help and there is always hope.